Hello, everyone. Welcome to this session on mental health in the world of work in times of COVID-19. I'm Hang Chong. I'm the moderator for this section from Labor Action China. And just as a background, mental distress at workplace has always been an issue, but understudied and undernoticed. But with the COVID pandemic, this issue has been brought to frontline, especially by all the stress, all the work pressure brought on by this radical change in working regime by the COVID pandemic. So we have been noticing a lot of, say, increased anxiety around getting infected, around job security, a lot of stress on, say, healthcare frontline workers. And the pandemic has also triggered individualization, informalization, and irregularity of work, the three I's. So all these are not conducive for mental health, but we haven't seen a very comprehensive respond to the problem. So that's why we are having this session today to start discussing on this mental health issue in the workplace. And we hope to, through this discussion, understand better what are the mental health issues faced by employees in different sectors in Asia Pacific, discuss the impact of COVID-19 on the mental well-being of employees at work, raise awareness about the roles of states, businesses, trade union in dealing with this problem, and also explore whether there's any possibility for revision in the current framework of how we handle mental health in the workplace. So this section today will be divided broadly into two parts. The first part will be some discussion on the challenges faced by different sectors and different workers in different countries. And the second part will be the discussion of solution about, well, we have seen all the challenges. What are the response? How can we respond to this? So let us now introduce you guys, all the panelists today. We have 5 panelists today. The first to speak will be Dr. Yuka Yujita, who is the Senior Specialist on Occupational Safety Health of the International Labour Organization Decent Work Team for East and Southeast Asia and the Pacific. She is a medical doctor with subspecialty in occupational health and medicine, and holds a PhD in preventive medicine. So the second one to come will be Raj Mariwala, who is the director at Mariwala Health Initiative. That is a grant-making and advocacy organization that focuses on making mental health accessible for marginalized community in India. So the third to come will be Tajin An. She is a staff from the Korean Health and Medical Workers Unions and also manager of the Gender Equality and Worker Safety in the union. Next one up would be Pierre Kartiyan Kariana from Thailand. So he started working with Solidarity Center in 2014 and he's currently the program manager. So his work is mostly to coordinate with trade unions partner to focus on strengthening workers' rights in Thailand through union organizing and campaigning. So, and the last one will be from China, Kathleen Schwartz, who is a program manager at China Labor Bulletin. The organization was founded in 1994 and support China's workers' struggle for decent pay, decent work, dignity, and rights. Kathleen herself is a US-trained lawyer with an LLM in international legal from New York University. So that's a brief introduction, and we let the panelists go first, and then we start the discussion on the challenges faced in the mental health area in the workplace. So we'll have Dr. Yuka Yujita first.
Thank you very much. Yes, good afternoon, good morning, good evening, everyone. So the first, let me present to you why mental health at work during the COVID-19 and what kind of challenges we are facing. And before going to the speakers from each country, let me briefly present the overview. Okay, so I don't see, it's very difficult to see. Yes, first of all, the COVID-19 pandemic is, of course, we all know that is the public health challenge, public health crisis. But why we are talking about the pandemic at the workplace? Because workers and people in the world of work have been at risk of infection. And the people are facing the risk of infection in their life, but many of us spend a considerable number of hours at the workplace. So some workplaces have become sources of outbreaks of the virus. We call it cluster. And actually, we had several clusters already we saw. And thirdly, the certain work settings are at particular risk because the COVID-19 is the transmit between people, the person to person. So if the workers has the close contact between workers or the client or the visitors or the other negative working conditions, working environment, maybe they are facing at higher risk. And the OSHA occupation safety and health risks in the workplace, of course, this time is the biggest risk is the corona exposure to the coronavirus. But at the same time, we should not forget about the other risks. Because even though we are facing the coronavirus, the other risks doesn't disappear. We have continuously, we have the facing the safety and health risks at the workplace, no change. And plus, due to the COVID-19 pandemic, we have the additional hazards, additional risks, chemical risks. For example, the exposure to the disinfectant or the ergonomics factor, because we are working from home and we have some problems with the working position. And it create maybe the back pain or some other health outcome. And here, the additional hazards and risks on psychosocial, including violence and harassment. Maybe I hope it's coming to the next slide here. Yes. So now I like to show you one example, the high-risk workers. Of course, the healthcare workers, social workers are facing higher risk. And we have the 136 million people engaging in occupation. But please have a look at the bottom right. 1 in 5 healthcare workers have reported depression and anxiety symptoms during the pandemic. You can see how high the impact of the psychosocial hazards and risks and the stress and what is the impact for the workers. Of course, the healthcare workers is the specific working situation, their responsibility, but it can happen all of the workers. And then the stress and the psychosocial factors during the pandemic, what kind of the factors, anxiety, because of of course, this is the new disease. We are very anxious about what kind of, symptom, what is the health outcome, how we can get this virus, or the uncertainty about how long this crisis will last. Already we are fatigued, the corona fatigue. And also many people are worried about the losing job or the changing job. And also all of us the experiences the radical change in the work organization, including the telework and the condition, right? So these factors will lead to the outcome, the common response to stress and the psychosocial factors. That is the low mood at the workplace, low motivation of the workers, and anxiety and the depression And the worst case scenario is the something, more, the needs, some medical attention. So I stop here. And I like to listen from my colleagues, the experience from each country. Thank you very much. Back to you.
Right. Thank you very much, Dr. Yuka, for the overview. So, yeah, it's really a serious problem when we see the number that 1 in 5 healthcare workers have this problem with depression and anxiety. And this probably will be reflected in other situations in different countries as well. So next up, we will have different countries sharing. So first we have Raj Mariwala from India. So yes, it's all yours, Raj.
Thank you. So I'm just going to get straight into it. So it's likely that everyone present today is aware of the devastating second wave of COVID-19 in India. And of course, while it caught the government unaware, the resulting severe lockdowns have only just heightened structural inequality, especially for India's labor force. Now, I have to say that this has made the situation of 2020 much worse because when the pandemic hit in 2020, the Indian economy was already in one of its largest slowdowns. And this was combined with a long-term lack of access to employment, poor working conditions, and very weak social security nets. So I would say currently, many people in the country, many experts are saying that COVID has sparked more conversations about mental health, about overcoming stigma, especially about mental health at work. But these conversations have mostly been around what it is like to do work from home. Some of them have spoken about the combination of increased household or care work for women combined with work from home. And overall, the focus has been on stress, burnout, and work life balance. So, the visible narratives of workplace distress have been limited to white collar workers. However, those who have been the most disproportionately affected, as well as invisibilized in these conversations, are marginalized populations and communities. So, the lack of health infrastructure combined with the intensity of the second wave has meant that many women have had to withdraw from paid work or the workforce to take care of family members, to do unpaid care work. And women and adolescent girls have been the most affected. Other than women and girls, trans persons and those marginalized by caste oppression and other such socioeconomic backgrounds have faced very high levels of work-related stress. Now, unsurprisingly, these communities form a very large part of the workplace sectors whose workforce faces distress. Now, some of these sectors are migrant labor, garment workers, informal sectors, and frontline workers. They've already had some concerns before COVID, like gender wage gaps, workplace harassment, violence, economic violence, and a lack of safety. So now to illustrate some of the psychosocial stressors faced at work, I'm going to use some specific examples. First, the garment industry, which consists of largely women who are also migrants, has been very affected by lockdowns. The stress has been coming because many companies did not pay their workers or, in fact, fired them without due process or compensation, which has left them in distress without savings, food, shelter, or any kind of organized support system. This is despite government advisories. Now, this sort of income disruption is causing very high levels of distress, not just for the workers, but also for their families, as they tended to be the most stable breadwinners for their families. Now, for the garment workers who were not fired, many of them were living in overcrowded worker hostels where physical distancing is impossible. And due to lack of even minimum wage being provided, a lack of consistent access to masks or water. For the factories that weren't shut down, social distancing was not implemented, leading to illness for workers. Now, this illness was compounded by the fact that the workers did not have health insurance or health services. For those who did get masks from their workplace, they had to wear them for long hours, which was impossible because many states suspended labor laws. In fact, 12 states in India suspended labor laws. So daily work hours were increased to a maximum of 12 hours. The same suspension allowed factories to lay off workers because they were classified as contract labor rather than employees. And if I have to make a distinction, sectors with a different composition of worker pools, such as the auto sector, established male workers, successfully went on strike to force management to address COVID-related safety concerns as well as job security. Another sector with a similar composition of largely female labor is frontline workers, that is both health workers and sanitation workers. India has a 1 million strong force of female health workers who serve as accredited social health activists. They are integral to primary health care, especially in rural settings, and they are seeing the same disruptions in income despite extremely long working hours due to the pandemic. And even during COVID, they have had to go on strike to collect the monthly honorariums they earn. The uncertainty and anxiety they are experiencing extends to the risks that they are compelled to take at work. Exposure to patients and communities without masks, gloves, we can forget PPE suits. Now, this results in guilt and fear of exposing their families to COVID as well. They also do not have any social safety net, no guaranteed access to healthcare for themselves if they fall ill, as well as an expired government life insurance scheme, leading them to stress out about the fact that they are fighting this pandemic without assurances that their family will be supported if they die. Finally, of course, there is no sort of solution or support for the compassion fatigue or trauma they are exposed to in the daily course of their work. The situation is same for India's sanitation workers who are integral to India's waste management. They are not given any protective equipment. They are not given hazard pay, despite having to clean waste, which includes biomedical waste and waste from infected persons. Similarly, they have been hired as contract workers, so they have no job security, no guaranteed living wages. If they fall ill, they will not be paid sick leave wages. So again, finally, I want to say that for all of these women, whether in the garment sector, whether in the frontline sector, the public health stigma around COVID and the criminalization in the health response has led to these workers being treated with discrimination, xenophobia, and suspicion in the places they work or live. I'm going to end right now and I'll post a YouTube link so that you can see it at a later time. Thank you.
Thank you, Raj. So it's really good that for Raj to highlight the fact that like mental health problem is not a white collar thing. I mean, we tend to think of that a more white collar problem, but no, but actually the marginalized are the ones most affected, but without a voice and without people seeing what's happening to them. So next one, we will have Tajin, who will focus more on the Korean health workers and see what they are facing in the COVID era. Yeah, Tajin is all yours. We can hear you. Hello? Hello? We are not hearing you at all.
Hello?
Hello, yes, yeah,
Can you
that's
hear
all
me?
right now. Yes, now we can hear you.
Okay. Oh. I can talk about healthcare worker in Korea. Healthcare worker in Korea is suffered from overall mental health deterioration due to COVID. In case of medical institution, the density is very high, and since it is a multiple use facility, there is a high risk of infection. Korean has designated a medical institution dedicated to hospitalizing COVID patients centered on public hospitals and workers, especially nurses, at those institutions had to care for COVID patients arbitrarily. When there was not much information about COVID and no system was built, the number of patients exploded, but there were no beds that could be hospitalized, and healthcare workers complained of serious health threats, anxiety, and suffering from the explosion of work. At the beginning of last year, nurses could not leave work if they were living with their families and lived in empty hospital rooms or funeral homes. There have been cases of receiving complaints from neighbors or local residents or being denied admission to child care facility about their children. In case of South Korea, it has been reported that healthcare workers suffered from verbal abuse and emotional labor from patients because the patients do not accept their quarantine obligations. There were cases of swearing, constantly questioning the authority of a medical practitioner, or throwing objects like that. In case of non-general hospital, conflict have been reported in the process of limiting the number of guardians, visitors, and access control due to concerns about infection. In addition, since hospitals have recommended movement restrictions that are stronger than the government guidelines for the workers, it can be seen that the restrictions on daily life are greater than that of ordinary workers. According to KHMU survey conducted on 4 million healthcare workers in 2021, 70% of healthcare workers say their mental health deteriorated after COVID. In addition, 62% say that COVID was a factor in their mental health. 60% of all nurses answered that the hospital did not guarantee their right to health. Recently, there has been a case, nurse who worked in public health center. She suicide while complaining about being overworked. Public health care and workers and local government officials are also overworked due to COVID. The Korean government is proud of their achievement, but all workers in public service sectors are sacrificing themselves nowadays. Thank you.
Thank you, Tajin. So we can see that actually the survey by KTMU seemed to show an even worse situation than what was just shared by Yuka, right? You got 70% of healthcare workers feel that they were being adversely affected by the COVID pandemic in their mental health. So yeah, this is a really serious problem that we all have to tackle together. And so next up, we will have sharing from Pia, who is from Thailand. And this session this part will be focused more on the gig workers. So we have some healthcare worker and all that. Now we have another sector. Yeah, Pia.
Hi. My name is P. Kritaya Kirana, and sorry for that long last name. I'm a program manager at the Solidarity Center, the largest US-based workers' rights organization. We affiliate with the US trade union movement, and I'm here on behalf of our comrades from the International Transport Workers Federation, or the ITF, to speak on the topic of mental health issues faced by platform food delivery workers. Food delivery workers are part of platform economy, which quickly grew to its prominence in the last decade. While the business is often mentioned as part of the new world of work, where you can see its prominence pressing how the technological advancement has been used to its full potential to fulfill human happiness and to create enormous number of jobs, or jobs that I would say, because as a trade union, when you say job, It means a work with decent pay, with protection, with benefits, with job security, with occupational safety, and with dignity at work. Things you don't see associated with platform economy and definitely not with platform food delivery workers. In fact, this is the business that more and more each day get exposed of how the technological advancement is not used for the greater good of mankind at all, but in fact, it has been used as a tool of exploitation, going beyond whatever we have seen before it, and it has been a tool used to make the most of people's labor while paying them or giving them the least benefit, the least job security, the least occupational safety, and the least dignity at work as possible. As some of you might already be aware, one of the most common themes among the platform food delivery is the way the companies can get away with getting the people so desperate for a job into the workforce without making them their legal employees, which means no legal protection whatsoever. And also, why this company use a flowery terms such as sharings or partners in order to make the platform food delivery worker not workers, but in fact, as a person, as me, that I have worked with many of these workers for years, and I have talked with over 100 of them in last year. I can tell you that these non-workers are facing the level of control from the companies beyond the conventional worker, such as if they make a mistake on their delivery, they get banned or their application shut down. If they have an accident or can't make the delivery on time, also the chance that they get banned without the company asking them any question. If they get complained by the customer for whatever reason, very likely also are the chance that they get banned for a couple of days, losing any chance to make an income for the living, and without any investigation or question asked or without the opportunity to explain to the company. However, the companies are half right when they say that these food delivery workers are not workers. The part they are right that these workers, while their working conditions are controlled by the company, are not legally protected as other workers are and as they deserve to be. What happens is they might wake up one day and find their pay is cut by half. They have no legal right to challenge that. They might wake up one day and the company double the workforce. That will certainly impact how many jobs they have each day. And since the companies are not required to pay minimum wage and benefit to any of these workers, so these workers are not legally entitled to social security or benefit. In fact, the company are using the benefit that these workers deserve to have as part of the incentive to make them work harder, such as instead of being responsible for the accident that happened with the delivery workers, the company set the minimum the worker have to make at least 220 deliveries a week or over 40 jobs a day for 5 working days in order for these workers to be entitled to the company paid insurance plan. In reality, forcing them to work a lot more amount in short period of time in order to get accident actual insurance is what actually increase chances and incident of accident itself. From my interview with one of the food delivery worker, he said, I also volunteer as a road accident respondent, and I have collect a lot of bodies who were platform food delivery workers like myself. So I think this is quite a shocking working condition. And for now, I'd like to end my first session, and we can touch upon this, include the solution in my second session. Thank you.
Yeah, thank you very much, Pierre, for sharing this really dire situation of the platform workers. Although they are under very, very heavy stress, work stress, and even dangerous working condition, but without any adequate protection. So there is an urgent need to discuss some solution for that situation, especially with the very large increase of platform workers in the COVID era. And last spare panelist to speak will be Kathleen. So she'll be sharing with us the situation in China. Yeah, Kathleen.
Thank you so much. I would like to focus on how economic issues and economic and social inequality are some of the root causes of workers' mental health challenges during the pandemic in China. And just a content warning, I will be talking about cases of suicide. So there were many economic challenges contributing to deteriorating labor conditions even prior to the outbreak of COVID-19. Workers were moving from more stable manufacturing jobs into the service sector and the gig economy, where lack of labor contracts and no dedicated workplace makes organizing for better conditions even more challenging. China Labor Bulletin, where I am a program manager, collects data about strikes and protests and workplace accidents in China. So we're very attuned to these trends across industries and regions. And with the effect of COVID-19 on workers, what we saw is that the pandemic really exacerbated these existing trends of workers flooding into the gig economy because of the work stoppages and business closures in other sectors. And so this has put pressure on those already in the gig economy who face more competition for work. And as Pia just noted, I think the challenges in Thailand are very similar to those in China. So all of that really applies. And then during the pandemic, society's reliance on food delivery drivers and package delivery workers during the pandemic was huge. And there was some prominent media attention on these workers' status as they were called slaves to the algorithm. So that brought popular attention on the issue. But I would like to highlight, looking at the number of protests and strikes in this industry is really instructive to see what's going on and what these challenges are. CLB's strike map, which is publicly available on our website, you can search it and check that out. We recorded 45 strikes and protests in 2019 by food delivery workers, compared to just 10 in 2017. And our work accident map recorded 121 accidents involving food delivery workers since 2018. And in 19 of those, the workers actually died. And with the pandemic, the ability for these workers to organize for better conditions has decreased. And this industry, has been so essential during the pandemic. There was a widely read investigation into the industry in late 2020, but there have been no policy changes. And even early this year, a delivery driver in Beijing was detained for organizing chat groups of food delivery drivers. But for all types of workers, the work stoppages from the pandemic led to decreased ability to organize. And we saw a major drop in collective action, such as strikes and protests, in early 2020. And those numbers have still not reached pre-2020 levels. So our strike map recorded only 800 collective protests by workers in 2020, compared with about 1,300 in 2019 and 1,700 in 2018. And this by no means indicates that workers don't have labor rights grievances or that conditions have improved. And in fact, most of the recent cases are over wages and arrears, which is a major factor in workers' mental health. The inability to provide for their families, the intense pressures and conditions necessary to earn even a meager salary. So at the outbreak of the pandemic, workers were pushed either to give up their labor rights in pursuit of immediate, new, and precarious employment. So this is that shift from, for example, manufacturing into the gig economy. Or many followed this trend that we've seen in recent years of taking very drastic measures to raise attention on their unpaid wages or other grievances. So a little bit more about that is there's a lack of enforcement of the labor laws in China. And this is a huge factor in pushing workers to these extreme measures, which is an indication of poor mental health. So as an example, if a worker is owed his wages and asks the employer for the wages, and this kind of escalates, workers often feel that the only way for them to succeed in their case is to raise a lot of attention and maybe get the attention of the authorities. And obviously this is not a good solution to this problem, in the sense that if there were more enforcement of the labor laws, this would contribute to better labor relations and, of course, better mental health for workers. So in summary, the workers may willingly risk arrest or physical harm, for example, to raise attention on just their ordinary labor disputes that should be, their rights should be protected by law. So for some context, our maps collect information about the types of protests, so a strike, a sit-in, or a roadblock. And actually the type of threatening suicide is common enough that we have a category for it in our maps. And since 2015, we have logged 435 incidents in this category out of about 11,000 incidents total. And these cases are typically over basic wages being owed. Of course, not all incidents of, indicating mental health issues at work are staged as a protest. And so 2 recent cases that I can share that received public attention will illustrate this. So one is a transport worker, a truck driver, who was fined 2,000 yuan, which is just over US $300, because his mandatory GPS system in the truck went offline just due to an error during a vehicle check-in. So that was in April of this year. And as soon as he received the fine, he just couldn't bear the injustice and the cost of it. And he posted some depressing messages online, and immediately went to purchase some pesticide and took his life because of this economic challenge and the work conditions. Another example is a white-collar tech employee at an e-commerce platform that's one of the major ones in China called Pinduoduo. And he graduated in 2020 and began working on product development at the company. And his colleagues noted that he was active in the group chat just before jumping off a building in his hometown because of work pressures. And the company came under fire for this. There were a number of other employee deaths from overwork, both white collar and blue collar workers. So these problems in the tech industry are quite major and receiving attention. And they have been officially acknowledged, notably at China's annual legislative meetings that occurred in February of this year. So the tech sector and overwork culture and these types of pressures were discussed. And an official from China's official trade union spoke to this issue as well, but no solutions or enforcement mechanisms have been offered. So in conclusion, these types of very dramatic events show the deep mental health challenges facing ordinary workers just trying to make enough money to support their families. And I would also like to note that China's work injury law does not cover worker suicide as a workplace injury, regardless of the circumstances. So this means that families are often unable to obtain any compensation from the employer. Thank you.
Thank you, Kathleen, for that very informational sharing. She raised a different point from the previous sharing that about the compensation, about how do you deal with people who have mental stress. This is of course very different from an ordinary occupational injury or even occupational disease. A lot of people who are suffering from mental health problem would not be classified as having an occupational disease and would get nothing from the relevant social protection. So that's maybe one of the challenges is on the issue of mental health in the workplace at work as well. And we can have a bit of time discussing all the challenges faced in different countries and around the world. And if all those who are participating, you can also raise questions in the question box, and we will look at them and raise it to the panelists. And since I don't see any question yet, so just a short summary of what are the issues that have been raised in the discussion just now. We see that there are some special mental stress caused by COVID that were discussed just now, the risk of infection itself, and also related to how the the businesses or the country have a lack of protection against COVID infection for all the workers concerned, especially workers who are at high risk, frontline worker or people or workers working in places where there are clusters of COVID. All this stress of infecting a potentially deadly disease can be a very high source or reason for mental stress. Second part of the problem brought on by COVID is how COVID being a very drastic, very emergent, very catastrophic kind of situation. That kind of situation itself brought on a lot of mental stress, especially to frontline workers who have to deal with all this catastrophic thing, like people dying, people in a very distressing situation without adequate help. All this is again a very special kind of mental distress that the current working regime seems not to have any adequate way of dealing with it. And also, a catastrophic situation brought on a lot of increased workload as well, and a drastic change in how you have to work, and workers are quite inadequately supported in adapting to this sort of sudden and catastrophic changes in the workplace. And other problem that have been raised, maybe less obviously related to COVID, may happen in other sort of situations as well, but it's also such problem that have been exemplified during this COVID era, such as the problem of job insecurity and the stress brought on by it, because while COVID, they bring about a lot of a very radical economic change in work pattern, and people the job security of a lot of workers have become very, very precarious, and that brought on stress to the workers, to their family. And this lack of job security, the fourth kind of stress brought on is the lack of social protection, right? This is especially obvious in cases like casual worker, platform workers that I just discussed. Well, without a job, they have no other support at all. And of course, there's no support for the mental health problem that they face in the workplace, even. But lastly, even assuming that the country had adequate social protection for work injuries, say, mental health is still a big lacuna that traditional occupational health and safety legislation and protection doesn't really consider. A lot of people who are suffering from mental problem was just classified as usual patients and were dumped into the usual medical security net if there one, and not deal with adequately in the occupational health and safety regime. So again, that's one of the very biggest challenge. Yeah, that's my not very brief summary. I still see that there is not that many questions. I wonder if any of the panelists want to respond to others people's observation. Well, if no one wishes to respond that, maybe I have some question that I can, ask the panelists then. Because from the email seems to relate more to the COVID infection itself and the different type of work regime brought on by COVID. But there's also a big big change of work regime that is brought on by COVID is the issue of work from home. I wonder if any of the panelists have ever observed what kind of mental health problem have been brought on by this quite extensive change of work pattern, in that work from home becoming quite prominent in this era. I don't know if anyone wants to respond to that. Yeah, Dr. Yuka.
Thank you very much. So before coming to your specific question, maybe can I just respond to your summary? Actually, the psychosocial factor hazards is one of the hazards at the workplace, the risks. So we have to address this particular hazards and risks. Maybe at the part of the prevention, the later the session, maybe I will address something in the risk assessment. But obviously, there's stress, the mental health should be addressed as one of the occupational safety and health hazards and risks. And secondly, regarding the mental health and including the suicide, the ILO has the list of occupational disease. It's not, the mandatory because each of the member states should adopt their own national list of occupational disease. But the ILO's list of occupational disease include the mental health problem. So we have to encourage the member states, the government, and social partners to review their own national list of occupational disease and update periodically according to the change of the world of work, the change of our working organization. And the third point, specific questions from the chairperson. Yes, the telework can be a source of the additional mental health problem. And some studies says the telework has the positive effect and negative effect. For some people, the more flexibility of the work and the life balance, or the more, some people is the higher productivity by telework, and others are lower productivity. But the studies show if the support from peer worker or the management, the supervisor, is provided, telework is not necessarily very negative. But without any support, the mental health is getting worse. That is my contribution. Back to you.
Thank you very much, Dr. Yuka. Anyone else wish to contribute to the discussion on the challenges? Right, I don't see any hands. I just want to check if there's one question. Oh, not question, actually, a sharing from Taiwan. Yeah. So the intervention is that the children of the nurses who take care of COVID-19 patients from the recent outbreak in Taiwan have been bullied and discriminated in the school. Right. So all the stigma brought on by working with COVID patient and working with COVID situation. Yeah, that's also would be one of the great stress that also extend the problem to the family and the children of the workers as well. And the second point to share is that almost all migrant workers are banned from going out even during the day off, while their Taiwanese colleagues still commute as usual. They're still totally ignored by the mainstream and general public. Again, that also seems to echo with what Raj had been sharing, right? The marginalized migrant workers, people who are under different type of stress under COVID situation. When there's a lockdown, all those migrant workers are treated differently from the people who are local, who are normal citizens in the countries, and effectively deprived of their holidays by being put in that lockdown with their employers. So I wonder if anyone wants to respond to the observations. Oh, yeah, Pia.
So I think I'm just gonna answer your questions about if work from home, there's any new landscape with the issue with the workers that I work with during work from home. So with the delivery workers, I think with COVID-19, more people work from home. That's also lead to more people ordering food delivery during this work from home periods. And this is a time where delivery worker they have lots of work. They can make more income, but in terms of they have to deliver to, I say at least 20 people a day. That also increase their chances of being exposed to COVID-19 symptoms. And as I talk to them, if this impact their stress, they said, of course, imagine you have no protection at all from the company or from the government. and you go meet 20 people you don't know each day. That's your job, and you don't know what they've been doing. That increase the chance of you catch COVID, and how that affect their like mental or their stress is that some of them say I live with my parents at home, my old parents, my elder parents, my kid, my wife. If I get COVID, I might survive, but if the people I love at home also get COVID because of me, because I'm the most risk person in the family, of course I will feel guilty for the rest of my life. So this may like answer part of your question. Thank you.
Thank you for all your contribution. Oh yeah, Raj.
Just very quickly going to address your question on mental health and work from home. And like I said, there has been a lot of discussion in India on work from home. And most of the issues that have been reported have centered around work-life balance and burnout. But, you know, if I have to give you a figure, 36% of white-collar workers in India reported that their mental health has worsened after work from home. And about 17% said that their physical health has worsened after work from home. So I think the major issues were burnout. Around 50% of those who work from home reported feeling stressed due to task deadlines or work deadlines. And of course, the work-life balance issue was much worse for female white-collar workers than it was for male white-collar workers. That's about it.
Right. Thank you all for your contribution. That's a very useful kind of statistic that been provided. Right. I think we have to jump on to the next part of it, or else we don't have enough time for our discussion. So we will start our discussion on the solution to all the challenges that we have been discussing just now. This time we'll go in a bit of a reverse way. We would like Dr. Yuka to have a summary of all the solutions that have been raised in different countries. So we'll go by countries first. So the first one we will invite for this part is Tajin. Right? Oops. Actually got offline. All right, back on. I think she's back on. Tajin, can you hear us? Hello?
Sorry, my connection is very. Hello, can you hear me?
Yes, we can. We can hear you.
Hello.
Yes, we can hear you.
Please
Yeah,
question
right.
me. Okay.
Sorry.
We'll talk about solution.
Yes.
Solution about solution.
Yeah.
I will explain the solution and the union activities related to it. In order to solve the problem of the diverse effects of mental health problem of healthcare workers caused by COVID, I think a stable and systemic management of COVID must first be prioritized at the national level. Every time a policy was implemented in a way that promoted activities in consideration of the economic situation, there was a pandemic. Again, during the pandemic, healthcare workers are forced to work without even having time to assert their right to health. Therefore, during the infectious disease outbreak period, the first priority should be the response to the infectious disease. The health and medical union has been active as an opinion group leading the government's quarantine policy from the time of MERS in 2015 to Corona in 2020. Second, sick leave should be allowed to be used without discrimination, even in the case of mental health disorders. KHMU is demanding that the period of paid sick leave be extended to more than 60 days in this year. In addition, in the case of Public Hospital Labor Union, request for paid leave for emotional labor for all employees. Third, there is need for a paradigm shift in Korean industrial accident insurance, which focused on existing physical disasters. In case of industrial accident with mental illness in Korea, it takes a long time to be recognized and it excluded from rehabilitation programs. In addition, most of the large hospitals in Korea are not industrial accident insurance, but are covered by private education pensions, so they are excluded from a wide range of industrial accident insurance system and system. Workers' compensation insurance should be expanded to all working people. In the case of Korean Confederation of Trade Unions, including the KCTU, they are currently fighting in front of the Ministry of Employment and Labor to reform the industrial accident insurance system. Fourth, after the nationwide vaccine is carried out, after the COVID enters a quiet period, national level of investigation and support measures should be made of occupational accident or illness. Currently, some programs for health and medical workers are being operated, but the target range is very small and the sample of mental health research is very small, so it is difficult to understand the overall situation. Basically, if investigation and support measures are not prepared, it is judged that the devices for the prevention of mental disorders of healthcare workers cannot be taken even in the future of infectious diseases. Thank you.
Thank you. Thank you, Tajin. So some good discussion, some good suggestion on how the government's response to COVID to be more systematic, how reform can be made to the industrial insurance system, and how union section will be quite important. And that's the Korean experience. So next one up, we will have Raj to share with us the Indian experience in responding to this problem.
Thanks. So, I'm going to start off by saying that COVID has highlighted the need to challenge the prevailing narrow biomedical discourse on mental health at work. So far, it's been framed as loss of productivity or absence from work or linked to particular illness such as depression or anxiety. Now, this sort of framing also leads to very tokenistic solutions such as awareness or anti-stigma programs, or at the very best, employee assistance programs that look at treatment, such as telecounseling services. Now, from the examples I shared earlier, the very first step to address this issue is to center mental health as psychosocial, meaning that we need to look at mental health as influenced by psychological factors as well as social cultural contexts. Now, taking into account these contexts as influences on a person's mental health is critical in providing support and care. Additionally, providing social support or non-biomedical interventions is essential and can be preventative and critical to promoting good mental health. And finally, if I have to talk about this a little more, I'm going to say that mental health cannot be considered separate from other areas of development, such as education, employment, emergency response, and human rights. Now, if we use this approach, to address workplace or occupation-related distress, we can see that there are some common stressors from whatever the speakers shared before. Excessive job demands, job insecurity, conflicts with supervisors or clients, threats to personal safety, job security concerns, burnout, and of course the lack of social safety nets. So the solutions for this then, if we frame mental health at work like this, as a structural issue, this means that measures need to be taken at 3 levels that work in tandem: the ecosystem, the sector, and the organization. So the government needs to bolster the ecosystem using both social assistance measures such as subsidized food or employment programs, as well as social protection programs that provide safety nets in case of health-related issues, accidental injuries, unemployment, etc. Now, individual sectors should play a role in walking government alongside walking the government in offering such insurance schemes with part contributions from the government and part contributions from the sector. Now, related to this, both government and business need to bear upon insurance providers to include mental health coverage as part of health coverage. Making steps towards the parity of physical health entitlements and mental health entitlements is critical and is the responsibility of both the state and business. This means having reasonable accommodations at work as well as compensation in case of mental illness at work. And linked to that, each individual sector has to consider unique stressors for all workers that are unique to that particular sector. For example, compassion fatigue and post-traumatic stress for healthcare workers. Now, these steps also require holding both government and business accountable, for which the role, legitimacy, and validity of unions is critical when it comes to identifying, advocating for, and addressing mental health concerns. So it's critical that the right to collective action be honored by law, and this must go hand in hand with just and equitable labor legislation that protects the rights of workers. Currently in India, the same is in danger as the government has changed laws for ease of business that gravely affect workers' rights. For individual organizations, they have to look at their organizational culture and how it may amplify or reduce stressors among employees. And culture means not only its physical space, but also work ethic, communication patterns, and written and unwritten codes of conduct. And finally, unfortunately, there has been a lack of communication and solidarity between mental health movements and labor movements. Mental health advocates need to foreground the need to have tripartite consultations on labor laws, to ally with worker movements, and to work on workplace cultures and management practices that address how workplace policy and systems affect mental health. More solidarities need to be built with women's rights movements and disability rights movements to ensure that sectors and organizations move beyond things like offering counseling to white-collar employees and instead move to preventatively address psychosocial distress by addressing employment-related stressors, starting from hazardous work to violence within the workplace, productivity pressure to social safety nets, as well as rights that workers are entitled by law. So I'm very quickly going to end by saying that workplace mental health is a structural issue that needs intersectoral interventions that reside in the larger ecosystem. The move to building robust workplace mental health systems must foreground the marginalized, because if we build systems for the margins, everyone will be covered. If we continue to build systems starting with the center, that is urban white-collar workers, we will never reach the margins.
Right. Thank you very much for the very systematic analysis of the problem and to provide quite comprehensive suggestions from both the ecosystem, sector, and organization perspective. And that will be very useful for our discussion. And next one up, we'll have Captain.
Thank you. So I would just like to start by saying that as this panel shows, there are common challenges facing workers across regions and sectors. And so I think international solidarity is really important. I think gains for workers in one region or one sector could have ripple effects, particularly if they occur at a multinational company or providing a model for regulating certain industries. So I think the need to share success stories and advocating across regions and socioeconomic class for sustainable practices is really important. I would like to note that we are seeing a raising of awareness in society in China about mental health issues whose root cause is employment. And so whether that's labeled as mental health or not, maybe due to social stigma, one solution to addressing the mental health challenges may be to focus on the root causes, such as the economic and social challenges. So overwork, while being underpaid, the lack of social mobility, despite achieving high education levels. And then, of course, the family pressures, such as caring for aging parents and the inability to afford having more children. And I know that China just introduced a 3-child policy, which was pretty widely ridiculed online because, people and young people especially feel they are unable to afford to do so. And this is true for almost all classes of workers in China, particularly white collar workers who are realizing that they aren't able to achieve the standard of living and quality of life that they feel they were promised under China's economy. And so, especially as China is promoting that it was the only major economy to recover in 2020, workers are just not seeing their share of that. And the situation is worse for them now. And this raised awareness about these challenges related to work is creating a type of class solidarity, although its impact really shouldn't be overstated. But middle class office workers talk about being laborers in the sense of a blue collar worker and relating to the grind of blue collar work. And young people are really open online about this increasingly common experience, and they've coined some new terms. One of them translated as lying down, which refers to this concerted apathy in work and life in general, which again is an indicator of these mental health challenges across society. And I should also note the gender and regional disparity, that depression, for example, has higher prevalence in women and for rural women. So one challenge in this conversation about economic opportunity is that the middle class does not want to work overtime, as that affects their mental health and quality of life, whereas the blue collar workers are concerned with how to earn more wages, including through taking on increased overtime. But across socioeconomic classes, workers are very aware that the status quo is not sustainable. So I think the way that these conversations and solutions are approached through this economic avenue could be very beneficial. And I would also like to talk a little bit about the potential for worker organizing and also the role of unions. In China, it is very difficult for workers to organize, especially during the pandemic, but also because of restrictive political and online environments. But we at China Labor Bulletin have seen some major success of the organizing model that we practiced in China in the early 2000s when we applied that to other regions. And so, for example, we have some partners in India, and prior to the pandemic, we worked with these women garment workers to advocate for things like clean drinking water, better transportation to the workplace, and also anti-sexual harassment provisions in the workplace. And we saw that these all greatly contributed to positive mental health outcomes. So we do believe that organizing, gaining recognition from management, during the pandemic, the workers were better able to advocate for their own needs. Although, especially as Raj pointed out, there are severe challenges and the rolling back of labor laws and things like that. So that shouldn't be overlooked. But we do believe that this type of organizing model where workers are advocating for better conditions for themselves is a strong solution that could be applied across the region. And just a word on the potential of unions, including state-structured ones, which we see in China, where it's not possible to form an independent union outside of the state union structure. China Labor Bulletin has been pressing China's official union, which has vast resources, to do more to represent the interests of China's workers. And through our investigations and interviews with the union officials, they don't have a great track record at representing workers, even despite high-level calls for the union to reform and to do better at that. But we select individual cases and call the trade union to ask whether they can intervene on behalf of the workers. And we have seen very positive results from this resolution of the labor disputes. And often these cases are workers who are quite distressed in their labor dispute. So we have seen positive results, and we would encourage other workers and organizers in states with a similar official union structure to explore this avenue. And just two final notes on solutions. States could more effectively regulate tech companies and the gig economy. And this could be as simple as enforcing the existing labor laws, providing efficient remedies for workers, but also new legislation targeting the particular challenges of workers in the gig economy is warranted. And companies operating in China could promote the establishment of enterprise-level worker committees, which is allowed by China's labor laws, so they could be more responsive to workers. So I think there are a range of solutions on a number of levels. Thank you.
Right. Thank you, Caitlin, for the sharing, and especially for highlighting the importance of the union's action and how workers' empowerment would have to be the root solution to all these issues. And we have Priya.
Okay, so back to the second session. So this is when I'm supposed to speak about the suggest solution, but obviously 5 minutes were not enough to touch upon all the fundamental issues that lead to the mental stress of platform delivery workers. And from now on, I like to play 2 video clips and let you all decide if this is what happened to your everyday work life, how much impact would it lead to your level of stress and mental decline. So let's see the clip.
พระครูพิทักษ์พัฒนานุกิจนะครับรองเจ้าคณะแขวงสายไหมน้องเราไปส่งงานเรียบร้อยแล้วทีนี้จะกลับมารอที่จุดเดิมเพื่อที่จะรองานน้องในกลุ่มไลน์มาบอกว่าพี่ใครว่างบ้างไปดูแคทหน่อยแคทรถชนแต่พอเราไปถึงจุดเกิดเหตุเราเห็นรถแล้วแหละเพราะว่าเราไปจอดข้างหลังเราเห็นรถแล้วว่าเนี่ยรถน้องเราแต่คือเดินผ่านไปอีกนิดนึงน้องนอนอยู่หน้ารถแล้วสภาพน้องเราเอาซุดตรงนั้นเลย
ช่วงเที่ยงถึงบ่ายแล้วก็ช่วงเย็นเนี่ยอุบัติเหตุของแก๊ปจะเยอะมากยัน2 ทุ่มอะไรประมาณนี้ครับจะเยอะมากเพราะช่วงนั้นก็เข้าใจแหละครับว่าเขาต้องทำรอบเพื่อเก็บเพชรที่อย่างที่เคยได้ฟังเรื่องเพชรเรื่องโบนัสเขาจะเก็บช่วงนั้นเพราะช่วงนั้นเป็นช่วงกอบโกยที่เพชรจะได้ยอดสูงแล้วอุบัติเหตุมันก็จะเกิดช่วงนั้นบ่อยเรื่องประกันนะครับคือบริษัทเขาก็มีประกันให้นะครับ
ที่คุณกิ๊กพูดถึงคือยังไงคะอ๋อก็คือเหมือนเราใส่ไอ้โม่งเลยนะคะใส่หมวกกันน็อกใส่เสื้อคลุมใส่กางเกงยีนคือทุกอย่างมันเหมือนผู้ชายหมดแหละแต่ว่าด้วยหน้าแอปที่มันเป็นบ่งบอกคือผู้หญิงมันคือหน้าแอปเวลากดเรียกค่ะมันเป็นหน้าเราอยู่แล้วคือยังไงเขาก็เห็นหน้าเราในแอปอยู่แล้วถึงเราจะใส่หมวกกันน็อกอะไรมีชุดอะไรขนาดไหนค่ะก็คือเหมือนการไปรับลูกค้าเนี่ยมันเหมือนลูกค้าอยู่ข้างหลังมันจะเจอบ่อยว่าจับเอวบ้างบีบหัวไหล่บ้างชวนไปโรงแรมบ้างแล้วก็มีแบบดึงมือไปแบบหอมอะไรอย่างเงี้ยค่ะหนูก็เลยต้องซื้อมีดพกไว้ที่ตัวแล้วก็ล่าสุดก็เหมือนกับแบบลูกค้าถามว่าไม่กลัวหรอมาวิ่งงานตอนกลางคืนไม่กลัวโดนปล้นหรือโดนทำอะไรหรอคือเขาถามเราหนูไม่รู้นะจุดประสงค์เขาพูดหมายถึงว่าเขาจะทำอะไรเราหรือเปล่าหนูก็เลยบอกว่าอ๋อพอดีหนูมีมีดที่ตัวเขาก็เลยเงียบ
Okay, so one incident, it's just like every day that you see people that you work with, that you talk to, that you're familiar with, like maybe not every day, but every week you see, you see like them like pass away, you see them accident happen, and then like this keep happening. And the second incident where there's basically no protection, and then you have to carry a knife for your own protection. So I think it's not hard to imagine that if this is the working condition that you are facing, how much that would that lead to your level of stress. And these are just the two examples of many, many real incidents that the food delivery workers are facing. The solution cannot happen on a case-by-case basis, but unfortunately, this is what most companies tend to do, such as they send flour to the funeral of the workers who died during the accident that happened on the delivery. And a couple of weeks after, they recruit more workers to enter the same cycle. And without tackling or trying to improve the working condition that makes this line more prone to accident, and also no consideration on lowering the delivery speed that force these workers to rush for the delivery jobs, no consideration on increasing pay that would make the workers' income more stable and reduce their need for urgency in the delivery, no consideration on improving the workers' insurance plan in case of accident that cost their life, and also usually just send flower cars and then recruit new workers to replace them. The company get away from all this with simple excuse. The law does not consider them as workers. Of course, the company is not only one to blame. The government that failed to understand this business model with the why the real demand, supply, and job creation opportunity do exist. But this model was designed to be not much better than a Ponzi scheme with the help of venture capitalism and aiming to avoid all the legal protection on the worker that has been the consensus since the formation of the ILO. However, we have seen some progress, such as the legal battles in countries such as the United States, Canada, or United Kingdom, that these companies are being enforced to take responsibility of their workers as required by the labor laws. We also see the case of Spain, which the court demanded the unions who represent these platform workers have access to company algorithm, so the worker have a say and can decide how this algorithm affects their working condition. United Kingdom, where Uber, the world leading ride-hailing application, recently recognized tens of thousands of workers who are represented by the national union GMB. In case of Thailand, there have been waves of food delivery strike in recent years, and which gave some of the improved working conditions, such as now one of the company provide an accident insurance for the worker in the time that they start working until the time that they log off the working application and go home. While the victory may still be slightly, and there's a long way to go to turn around the working conditions that were designed to maximize the exploitation on the worker. As a trade union, we believe there's no way better than these workers come together in the company level, in national level, or in the global level to demand decent working conditions and shares of income. And we believe that until these fundamental problems are resolved or improved, at least, there will continue to be the incident that put the lives of platform delivery workers and other gig economy workers into the highest level of stress, as they have protection of nobody, not the government, not the company, except themselves. And that's only happen when they decide to get together and fight. Thank you.
Thank you, Peter, for sharing. Again, a good analysis of how the problem come with a structural source, how the whole business model must be revamped to address the mental health issue, and how workers' action will be important in that regard. And so lastly, we will have Dr. Yuka, who will give us an overall summary of the overall strategy that is maybe more applicable in any countries, not just in one particular case study. Yeah.
Thank you, Chair. So already our colleagues shared a lot of good solutions, variety of solutions. Yes, a lot of proposal they presented. And then now I like to focus on the prevention. Of course, the compensation, social insurance, social protection is of course, one of the key. And many of the workers lack of that kind of, protection. But now I like to focus on the prevention. Yes. And the basic fundamental the measures for prevention in the area of occupational safety and health is risk assessment and the control of risks. And now I see this is the very, the basic procedure of the risk assessment. And the first we have to identify hazard. But this case, of course, the COVID-19 virus is the hazard. But we have to identify all hazards, not only the virus itself, but also to the other hazards. We can see from the challenging part, there is two different risks. One is the infection itself, the COVID-19 itself. And the second one is the COVID-19 pandemic, the source of the mental health problem. So we have to identify what is the hazards, what is the cause. Actually, the now is the Pia said, without knowing or the tackling the source of the core, what you call is the background and the root cause, we cannot address, we cannot improve the situation. So we have to know what is the hazard, what is the factor, what is the source of the stress, the mental health, right? And we have to consider not only the workers themselves, but the environment, our tasks, and what kind of measures already taken, right? And now, because the COVID-19 is the public health crisis, and also we exposed to that the threat entire day. So not only focus on just the workplace, we have to live 24 hours at home and at the workplace. So we have to think about the entire working day, right? Commuting, the communicating with my colleague or my family, etc. Right? And then next slide is this one. Then we can address the problem, but we have to address all workers. Actually, the large emphasize we have a lot of marginalized workers, vulnerable workers, right? And that kind of workers' individual characteristics, not only the medical condition, but also their working condition, what their employment condition, the psychosocial background, migrant workers, or the what kind of industry, what kind of sector they are employed, or without the employment. The Pia said about the platform workers, usually they are less protected. So that kind of individual characteristics should be considered. And then Caitlin emphasized the solidarity, the global solidarity. And yes, we have to share our experience. We have to share and disseminate the good practices already exist, because the COVID-19 is a new threat and the pandemic is very, new crisis to us. We don't know how to deal with, what is the best solution. What we can do is to share with the global community and apply the good practices, including the lessons learned, obstacles. And next slide is, yes. And I have to emphasize, I like to emphasize the cooperation between management, workers, and their representative. Already all speakers mentioned the importance of social dialogue, because the workers know their own risks, their own hazards, what they can do, what they cannot do. And management should respect, learn from the workers, and provide the policy and the instruction, guidance, or the taking measure. That is the employer's responsibility. But without good communication and dialogue, we cannot go anywhere, right? And that we can establish the good solution between in collaboration with the workers and employers. Now, of course, government plays a very important role. Teijin emphasized the policy, importance of the policy. Of course, this should be working together, government, workers, and the employer, to establish the good policy and the good plan, responsive plan, and the preparedness plan against the next possible. It's not a pandemic, I hope, but any crisis we will be facing. And we cannot come back to the same place because the world of work changed already and changing at this point. And we are focused on what will be the future of work. The ILO centenary in 1919 is created, the ILO, and the 2019 we are working on the centenary, and the future of work is one of the big initiative of the ILO. That is even before the COVID. We didn't know at the time what will happen next in 2020, but we have to think about what is our work, what is our task, what is our world of work will be changing, and what is our goal in the future, the better protection of the workers. Let's go together between the hand in hand, workers, employers, and government. That is my last slide. Thank you very much. Back to you.
Thank you very much, Yuka, for the very comprehensive summary. And we actually have a few questions, but we are also very short on time. So I try to be quick and summarize the 2 questions we have and see if the panelists have any responses to them. So the first question is more on the issue of working hours and pressure at work. So the interventionists noticed that the really long working hours prevails and cause severe work stress, even death due to long overwork. And on the other hand, the new type of economy, gig economy, requires, say, food delivery be done in a very quick and short time. So this is happening to logistic or food delivery industry everywhere. So how do trade unions or labor groups respond to this sort of situation? That's the first question. And the second question, is that I found that in discussions of psychosocial well-being, industrial voices often push to shift the focus to psychological issue or possibly culture and other issues in the society. And the experts of the psychological well-being often follow this kind of pressure, since it's meshed well with more medical perspective. But from a workers' right perspective, this undermines the attention needed to the question of how employment conditions more directly affect the psychological well-being. So that the tension between this mental health issue, between a medical issue, or is it a worker employment social issue? So the question is, I wonder if the presenters can offer their views of this problem and any thought on more effective response. So that's the 2 questions we have for the session. And if anyone wants to respond, can do it in a very quick way. Sorry about the short time. Anyone want to respond to those 2 questions? Yeah, Catherine.
Thank you. Yeah, I'd like to respond to the question about the long working hours versus the gig economy and how the trade unions could address it. So in China, these big tech companies are known for what's called 996, which is an overwork culture, 9 a.m., 9 p.m., 6 days a week. And then the person asking the question contrasted this with the challenges of the gig economy. So I would just note that, for example, 996 just outright violates China's labor laws on work hours. And I think what the trade unions need to do and what they themselves have promised to do, China's official trade union has a new focus on what they call 8 major groups, so different sectors of the economy, and really gaining membership in those sectors. But it hasn't led to any concrete measures that actually improve the situation for tech workers or those in the gig economy. And really the reason for this is that the needs of the workers have not been heard, have not been solicited, have not been heard. The workers need to be empowered to, raise their concerns. They need an avenue to do so, and the unions should be closer to the workers. The unions should represent the interests of the workers. And so in China, what we're seeing is that they don't have that relationship, and we've been urging them to do so. So in summary, each sector has its specific needs, and the workers are the ones who know how to resolve those challenges best. Thank you.
Thank you, Captain, for the response. Anyone want to respond to the other questions on medical and social? Yeah, Yuka?
Yes, I like to talk about the long working hours. Recently, the ILO and WHO published the new research studies result is that now is the 750,000 people die every year due to the long working hours by the stroke and the ischemic heart disease. And that is the shocking, the long working hours create the very negative health outcome. But due to the COVID-19, the people's working hours is the two extreme. Some people working longer and longer, and some people maybe lose the job and they decrease the working hours. So the ILO is working on the studies, the tendency or the outcome of the working hours and their impact to the health and also the other factor. But still, the study is ongoing. There is no definitive the conclusion yet. We have to keep watching, but we need to discuss. We need the dialogue between the workers and the employers. That is the more important now, because we don't know what direction we are going. So the dialogue is the key. That's my contribution. Back to you.
Okay. Anyone else wish to contribute or say some last words? Yeah, Raj?
I'll quickly try to answer the second question. And you're absolutely right when you say that the topic of conversation is more on the psychological, and that's simply because the experts who dominate it are trained psychologists or psychiatrists. But I have to remind everyone that the World Health Organization defines health as not merely the absence of disease. So now we can look at some diagnostic categorization of mental illness. And that helps us to maybe understand certain illnesses such as depression or anxiety. But mental health is much more than those conditions. It is a spectrum on which we may move up or down multiple times in our lives. So it's important to say that in this case, if we look at the psychosocial approach, dysfunction or distress doesn't come necessarily just from within the individual, but also from the environment. So addressing that or preventing it is a very non-linear process that looks beyond the clinical. So, which is why I said mental health movements, mental health advocates need to ally with labor movements and look at the importance of including voices of lived experience in conversations on workplace mental health and not just your workplace health experts.
Right, thank you, Raj. I wonder if Taijin or Pia have any final words that want to be said. If not, then I will conclude the section. Yeah, I think there's a very strong sense of that. Oh, Pia, I want to say something else. Yeah.
I'd like to add for the first question. So in terms of trade union involvement, you can see in the global level that the Global Union Federation, called the ITF, has been quite involved, and I think they play a role in the legal progress in the United Kingdom, which I think is the most advanced in terms, because this is where Uber lost the court case, and now they have to recognize that drivers as workers, as some part of like workers. And also I think they recently had I believe that's the first union recognition of the Uber. In the US, ITF also play a role in like having the referendum during the last November, the same time at the presidential election. But unfortunately, I think they lost to huge amount of lobbying by the gig companies in the Silicon Valley. So I think in the US, there's already Supreme Court similar to the UK, but when it's go to referendum in California, more people vote against recognition of like gig workers as the worker protected by labor law. And I think lots of the factor have deals with the amount of lobby that the gig company in Silicon Valley, like they pour, I believe that's like 300 million US dollars into the fight. In Thailand, it's not as bad as China. I mean, we do have some independent unions, but I think they're slow in responding to this issue, and they're also like more concerned about them losing a job, especially most of them in industrial sector, in auto sectors, which are now facing threat by the automation. But as the link that I paste in the chat box, so mostly like the riders, they get together by themselves. They're not organized. It's just because the company keep lowering the pay, keep making the working condition worse. So they get together by themselves. And yesterday, I believe in the past 2 days, riders from maybe 15 cities in Thailand, like that's huge. Like, got together and like stop working to protest the recent like reduction of the pay. So I think this will be a new phenomenon, and I think now it's a time for the trade union activists to figure out how to turn this into like some real bargaining power, because you see that it's enough. They see their exploitation violation as enough. They're ready to fight, but the question more like how we're gonna like turn all of these angers into the bargaining power, and to force the real structural change at the legislative level that would make their lives like the lives of these workers treated with better like dignity. Thank you.
Just to be fair, does Tajin have any final words to say? You're all right. Okay, then I will just summarize very quickly. Yeah, so I think a clear message from this session is that, well, mental health problem in the workplace is really structural. It's not a narrow medical thing. It's a structural thing, structural within the sector, within how the social safety net is organized. It's also a problem of how the workers' power is balanced or not balanced against the establishment and against the employers. So a structural problem that needs a structural response that cover all cross-sector, that cover across different movement, different campaign, and require solidarity from across different social movement and different workers sectors. And again, a very common theme is that unions action is needed, social dialogue is needed, and hopefully we can work more on this in the future when this issue has been getting more and more attention. And we do look forward to the IO study that you could mention just now. And thank you all for participating. And I'm told to give thanks also to Chen Kawei of Labor Action China for raising the idea for having this session today. Yeah, and thank you all panelists for contributing. Bye-bye.